On Monday, President Trump signed an executive order calling for fewer childhood vaccinations. The order recommends children only be immunized against 11 diseases, down from 18. It also recommends separating the combined measles, mumps, and rubella, also known as MMR vaccine, into 3 individual shots. And the president acknowledged this move was partly motivated by an unfounded claim that vaccines are linked to autism. The New York Times points out it's unclear whether the order actually has any legal power. Joining me now, though, to break all this down is Dr. Irwin Redlener. He's a pediatrician, director of the National Center for Disaster Preparedness at Columbia University, and senior research scholar at the Earth Institute. Doctor, it is great to have you here this morning. Nobody better to talk to about the stakes with a story like this.
Glad to be here. Thanks, Antonia.
So just begin for me with spelling out what alarms you the most about this change to the schedule.
Well, the entire press conference really disturbed me, and I think a lot of my colleagues are in the same boat. Here's what we're worried about. We're in the middle of the biggest measles outbreak in 35 years, and they make a series of announcements from the White House, from the Oval Office, that will actually exacerbate this outbreak. It'll make it worse for a couple of reasons. The first being that they completely repeated over and over again this issue about a link between MMR and autism. Yep. It is totally bogus. They keep repeating it. And if you're the president or the secretary of HHS and you keep saying that publicly, it is going to undermine people's trust in their doctors and in science. That's a disaster. And the other thing is this splitting up of the MMR into the 3 components. You need two MMR shots right now. That means you'd need 6 visits instead of 2 to get coverage.
A lot of families can't do that.
They can't even get 1 a lot of times. You know, poor children who live in medically underserved communities will have a really tough time now getting the vaccines that their children need. And it's just a disaster from one end to the other, and extraordinary lack of appreciation for the science, which has already established the safety and effectiveness of these vaccines.
Well, tell me, what does this mean for the new CDC director? She is a serious public health scientist. How could she let this unfold on her watch?
Watching this, I'm cringing on her behalf. Why? She was appointed 6 days ago. She was affirmed. She's a legitimate scientist and a public health expert, and now she's listening to absolute nonsense coming out of the White House about vaccines. I think she's going to be facing 3 choices, like right now. 1, she could hear what she heard last night and just say, I'm resigning. 2, she could disagree and get fired by, RFK Jr. for disagreeing with him about these new policies. Or 3, she could just hang in there and accept things that she knows not to be true. We're gonna see where she stands on all this, but I don't relish her position. She's in a tough spot.
I want to know what you think families should do now with what may happen here as a result, especially if you're a family concerned about having to make 6 visits to the doctor, concerned about being able to afford multiple visits to your doctor, just the logistics of it. If you live in rural communities, if you are disabled, this is going to be a challenge already. And then also just sort of what people should do from an information ecosystem standpoint. Listening to the president yesterday say that he's seen proof of vaccines being poured into children's bodies that are the size of soda bottles, just things that are completely crazy. If you are wondering, where can I get real information and help for my family? What should you do?
You should do what people have always done, is depend on your pediatrician or your family doctor or your nurse practitioner, whoever's giving care to your child. They understand what needs to be done for your kids relative to getting their vaccines. Do not listen to politicians. Bobby Kennedy Jr. is not a doctor. He's a quack, and he shouldn't be in that office to begin with. The president has no business talking about anything to do with health or especially vaccines. So unfortunately, hard as it may be, Antonia, you have to ignore them and go to the people that you should depend on, which is your doctor. They will tell you what to do. And I think that's the guidance that parents need to depend on.
That's what we've got to do for the time being. Dr. Irwin Redlener, thank you so much. It's always good to see you.